So that's kind of my passion, is helping endurance athletes, just because it is, a lot of the injuries that we see are cumulative trauma or repetitive strain, and a lot of endurance athletes, it's like they're hyper aware of their injuries, but they don't necessarily, they kind of hold out hope that it's going to heal on their own.
There's two roles I would never want somebody to play, and it sounds kind of harsh and I don't mean it to, but you can either kind of be the hero or the victim. So the hero, which is I actually get with my clients more than the victim role, which is just, yeah, it hurts, but I just got to work through it.
The length, the duration of time that you're dealing with a specific injury, whether it's disc or whether it's a strain that's caused by repetitive use, there's this compensation cascade that takes place. So the earlier that you get in and get seen, the less compensation that's taken place up until that point. So if you take a look at the neck or the low back, either one, there's postural strain that takes place to try to basically take the body out of that provoking.
Training clients in the beginning is, they don't have any kind of mind-body connection. They just know that's not normal, and so I tell them very quickly, like, they say, wow, that really hurts. It's like, okay, does that hurt or is that tough? Because there's a huge difference.
Yes, especially with low back pain, the core stability component is huge, and we see that a lot. And what we see a lot, especially with low back pain, is there's usually other issues that we find out about later on. So with quite a few of my low back patients, we'll start working on the low back specifically, and they'll come back in 1-2 weeks later after we've had a couple follow-ups, and they'll say, I didn't expect it to get better, but I've been dealing with the knee issue for a long time, and the work that we've done on the low back has actually affected the knee or the ankle.
So some of that is, it's just kind of a journey, and constant feedback for me is really important. And like I said, if there needs to be an actual diagnosis, we think there's a real problem, that's when somebody like Michael, or somebody like a medical expert can come in.
So one of the, and we kind of hit on this earlier, but not seeking help early. So we see it a lot of times where our athletes are just, somebody that sits at the desk for 8 hours a day, they have this issue that arises, and again, they hold on to this hope that it's going to get better on its own. And in some cases it will, but if you have an injury that's been going on for longer than a couple weeks, 2-3 weeks, the likelihood of it getting better is not very high. And so coming in, and a lot of times it can be something relatively simple in the office that we can give kind of, some corrective exercise they can do at home or do at work. And they come back reporting a pretty significant difference in pain versus 2 months, 3 months out, and they're still dealing with this nagging issue, but they don't necessarily realize what they can do throughout the day.
So the sooner the better.